Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. On January 2nd, 2025, an article appeared in JAMA. This is the Journal of American Medical Association. And it stated that recent research confirmed breast cancer screening, starting at the age of 40, is not only more cost-effective, but it also improves patient outcomes. This is not news to anyone in the breast cancer world. Believe me, we have been doing this for 38 years, and we know the importance of starting screening at age 40. But now, why is this important at all? Because last year, the United States Preventive Services Task Force announced that they were changing their guidelines from starting at the age of 50 to going back to what it's always been, starting at the age of 40. If you remember, this is the group that dictates all recommendations on preventive services. And yes, we were very happy last year when they changed it back to age 40, but it's not enough. They want us to do it every other year. We insist on every year. And another thing I want you to be aware of is in September of last year, there was a change in the Mammography Quality Standards Act, which is the regulation that governs every breast imaging center. That change involved that we must inform every woman of the level of her breast density. That's a good thing. We've been doing this for a while. But what happens when you have extremely dense breast? You need supplemental screening. So at the same time we are being regulated to make sure every woman knows her breast density level, the Preventive Task Force said, well, there's not enough evidence to recommend supplemental screening with MRI or ultrasound in women regardless of their density. Now, where does this leave you, the patient? It means you may have to pay out of pocket for that expense. It means your insurance company may not cover it. Most likely they won't because it's not part of the recommendations. You know, one of the things that we fight every year here at The Rose are insurance denials. We have to do appeals, and we're glad to do them. But there comes a point when you have to realize your health is going to depend on if you can afford it. So many of our women are not insured. But even if you are insured, it may not be covered. I want us to keep in mind that the Affordable Care Act, which passed way back in 2010, says that private insurance companies must cover a range of recommended preventive services at no charge to the patient. Mammograms are one of those services. And you know, it's unbelievable to me that since the Affordable Care Act was passed, there have been 2,000 plus legal challenges to it. This is the same legislation that says a person cannot be denied health care coverage due to a pre-existing disease. If you're old enough, you remember what a nightmare that was when we had to stay in jobs just for our health care coverage because we had some kind of pre-existing condition. There are so many good aspects to ACA on top of making health insurance affordable. But at the end of the day, once again, to have a mammogram at whatever age is not a woman's decision. You know, a very wise woman told me once that she found a lump in her breast. She was in her late 20s, 30s, and she was told that she needed an ultrasound. But she was also told her insurance would not cover that cost. She challenged the insurance company. She asked them why they wouldn't cover it. And then she asked them if they would cover the cost of her funeral. Of course, they laughed at her. Now, fortunately, this woman had enough money to pay for the ultrasound. And it was so incredibly important in determining if she had breast cancer, and the results of her test indicated that she did. Her biopsy confirmed it was cancer. That was over 25 years ago. She's been cancer-free for 25 years. She's now retired. She continues to help people. But 25 years, think about it. Even then, we were having to challenge the decisions that weren't made for our good health. I just wonder how many more years we're going to have to fight this. I wonder how many more years women are going to put off having a mammogram because it's not covered. I wonder how many decisions about our life and our body will continue to be made by other people. Those same people who are sure not going to pay for our funerals. So if you have a question about your breast health, call the Rose. If you don't have insurance, call the Rose. If you do have insurance and you're having trouble getting it covered, call the Rose. That's what we're here for.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.